All right, so when we're doing the ligaments of the ankle, same idea. We want her at 90 degrees of dorsiflexion. We'll see. You can tell how tight she is. She can't even get there, so she needs to work on that, but that's a different story. So we're going to start on the medial side. We got the medial malleolus. Always find the biggest landmark, and we're going to use it as a reference. So medial malleolus, and the deltoid ligament is going to be basically this whole area. It's a collection of a whole bunch of different ligaments. So for our purposes, we're going to call this whole area sort of the deltoid ligament on the medial side. But as we roll over to the lateral side, let's talk about the 4 individual ligaments. We're going to kind of rotate it a little bit so it's easier to see. Again, lateral malleolus, and we're going to start with the anterior talofibular ligament. Do not call it ATF. I want you to get used to saying the name out loud. So it runs right here. There's this little depression right in here, and I'm going to let Mary draw in our ligament. So right about there, that's our talofibular ligament. So you can start on the lateral malleolus, drop into this depression called the sinus tarsi, and that's where the anterior talofibular ligament runs. We have a next one. It's going to be calcaneofibular. Start right here on the distal fibula and come straight down right about here. We'll draw that one in. Beautiful. That's calcaneofibular. I'm going to rotate a little bit, make it easier. And right about back here, running from that lateral malleolus back, is the posterior talofibular. So if you kind of look at a clock, we have basically a 3 o'clock, a 6 o'clock, and a 9 o'clock. So these are the lateral ligaments of the ankle. Easy to palpate in terms of the location. You may not actually be able to physically feel the structures because these are very, very small finite ligaments. But the 4th one is a little bit harder. What we're going to do is we're going to palpate this distal fibula. We're going to move up the fibula a little bit, and you're going to feel a little bit of a gap right in there. So I'm going to make sure you guys are on it. That area right there. So it's above the malleolus. There's a little gappage right there. That's where the tibia and the fibula articulate. And there's obviously a ligament that has to connect those. So that is your anterior tibiofibular ligament. Some people will call it the anterior inferior tibiofibular ligament because you have one proximally up here by the knee. But down here, you'll feel that little gap. And as she dorsiflexes and plantarflexes, you might feel that it's actually separated a little bit like a pincer. But right there, that's your anterior tibiofibular ligament.